Look in your home. Look in your office. Look in your home office. Everywhere you turn, there's so much smart. At Capella University, we think education should be smart too. Our game-changing FlexPath format puts you in control of your master's degree, so you can learn how, when, and where you want. Smart, huh? Yeah, we think so too. So if you want to take the next step in your career, make Capella your first step. Visit capella.edu to learn more. Capella University. Don't just learn smarter.
Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert. I am here today with my very amazing and esteemed co-host, Dr. Millicent Ravello. How are you?
I'm doing well. How are you?
I'm feeling pretty good. I'm pretty excited about this new podcast format.
Yes, we are branching out. We no longer have faces for podcasts. We are now putting ourselves out there visually.
But we didn't call hair and makeup for this. We're just going to we're winging it on that thing.
We're winging it. Fresh off a day of seeing patients and operating.
You can see like the very fancy outfits we've put together, and we're ready for the whole TV, YouTube streaming thing.
This is why we did podcasts previously, but we are branching out to a video format.
I think it's good because plastic surgery is a visual specialty.
By definition.
Yeah, so we need to show photos and videos and all that stuff. So that's what we're going to do. So today I want to jump right into it, and I want to talk about breast augmentation in a much more visual sense.
Right. Breast augmentation or breast implants, one of the bread and butter procedures that we do. It's one of the most common, if not the most common plastic surgery procedure done in the United States. So it's important that we have a very real, honest, educational discussion about what exactly breast augmentation is about.
Right. And it's a pretty straightforward procedure where a woman or man becoming a woman or whoever wants to have larger breasts.
Larger breasts. It is, but it isn't.
No.
I mean, there is a certain group of patients where you can put a pair of implants in and that patient looks great. But I would say that's like 15, at most 20% of patients.
Totally.
It's not just a breast aug. Every patient needs a little bit more finesse. You know, like if you really want these to look good, you do have to put in a little bit of effort. I don't think you can just say it's just a breast aug.
Right. So it is an artistic endeavor.
Definitely.
I know that people think of it as a very simple procedure, but I am in full agreement with you that there is a very significant amount of artistry and planning that goes into generating a great result with a breast augmentation.
I couldn't agree more. And breasts come in all different sizes and shapes, and desired outcomes are all different sizes and shapes. And it's not always as simple as it sounds to just throw an implant in there.
No. I do want to note that we both agreed with each other 3 times over. So if we're keeping score, we want to have that on the scoreboard.
Good.
So who is a candidate, Dr. Ravello, for breast augmentation? Is it somebody who's just a woman with small breasts, or are there women that have some breast tissue? Who's really the candidate for breast augmentation?
I think as long as you are healthy and able to undergo surgery, you are a candidate for breast implants. You could be, small caveat, you should be of a certain age. The breast implants, the silicone breast implants are actually approved in women over age 22, saline in women over age 18. Those are kind of nitpicky things. Those are not hard and fast rules per se. But ideally, your breasts have stopped growing. You've reached maturation of your breast tissue, and you've decided that you are ready physically and emotionally, mentally to have a breast augmentation. And then the upper age limit, 80 years old. If you're healthy and you want bigger breasts, come on in.
That's right.
Like, there's no limit. The only thing that really changes is whether or not you need a lift along with the implant. And that's a whole different topic. But as long as you are healthy and physically able to undergo surgery and you want larger breasts, you're a candidate.
Yeah, and the goal really is to have better looking, larger breasts.
Yes.
Now, some patients just want to fill out what they used to have, especially in the postpartum woman who has lost breast tissue from postpartum involution, which means after having a baby, and you don't necessarily have to have breastfed, the breast tissue tends